So in chapter 11, we're going to start going over the different routes for medications. So oral drugs are given by mouth. They go into the GI tract. This is the most common route for drugs. The procedure is non-invasive, meaning that we don't pierce the skin to inject or insert anything into a body opening like the vagina or the rectum. There are downfalls, though, to oral drugs. They have a slow rate of absorption and they take longer to start working. Some of them might stain the teeth or taste bad or cause nausea since they go into the GI tract. We can't give oral meds if someone is vomiting, if they're at risk for aspiration, if they can't swallow for any reason. When you have an order for an oral med, it's going to say PO or by mouth or orally as the route. There are different types of oral meds. Capsules, these are small containers that hold either a dry powder or a liquid. They can be timed released or sustained release with granules that dissolve at different rates over a period of time. So there's a continuous release of the drug. This is nice because then the resident won't need as many doses throughout the day. Tablets, they're like dried powder compressed into small discs. They can be scored. This means that there's a groove to use for cutting it in half. Layered tablets have more than one drug combined in them. Enteric coated tablets have a special coating that doesn't break down until further in the GI system to help prevent GI upset. It's important to know that all of these cannot be crushed or chewed or split. That scored tablet is probably the only one here that can be crushed or chewed or split in half. Not necessarily chewed, sorry, but crushed or split in half. Caplets are tablets shaped like capsules. And ODT, or orally disintegrating tablets, are put under the tongue to dissolve rapidly. Sublingual film or strips are strips that are placed under the tongue to dissolve quickly. And lozenges or troches are discs that contain medicine with a flavored base, kind of like a hard candy. These are to be sucked on to slowly dissolve. Then we have elixirs. These are clear liquids made up of a drug dissolved in alcohol and water. Sometimes there's flavoring that's added. Emulsions are small droplets of water in oil to increase the ability to dissolve. Suspensions are liquids that contain solid drug particles, so we have to shake these to mix them well. And syrups are drugs that are dissolved in a sugar solution. Some equipment we'll use, souffle cups. These are small paper or plastic cups used to hold tablets or capsules. Medicine cups, these are plastic containers with measurements on the sides to measure liquid drugs. Medicine droppers are small tubes with measurements that give drops. Teaspoons are 5-milliliter measuring devices. So we never want to tell our patient to pull a teaspoon out of the drawer and use it like at home. This is not a guaranteed 5 milliliters. Only a calibrated teaspoon is appropriate for medication administration. Oral syringes, these are plastic measuring devices with a tip, a barrel, and a plunger to measure liquid and squirt into the mouth. Never use a parenteral syringe for oral drugs. So again, safety, 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 right? We use the 6 rights of drug administration to prevent drug errors. To prevent infection, we wash our hands and wear our gloves. There's a list of rules for giving oral drugs at the box on the bottom of page 119. There's some general rules like giving the most important drug first, like antibiotics or drugs that affect the heart. That is just because, especially if we are working with some elderly patients or residents that may be resistant to taking multiple drugs. We want to make sure that we're getting the most important ones, first. Those are priority. Give solid drugs, then liquid drugs. Don't mix solid drugs with liquid drugs. Stay with the person while they take the drug. We do not leave the drug at the bedside unless there's a doctor's order to do so. But I will tell you right now, I don't think that that will ever be done. And we've kind of talked about this before too. If I leave a drug at the bedside, I can't guarantee that my patient or resident is going to take it. I don't know if they're going to take it, even if I trust them. I don't know if they're going to wait and take it a couple hours later. And then we're looking at, getting close to, another dose that's scheduled. I don't know if their roommate is going to take it. I don't know if they're going to drop it on the floor. I don't know if they're going to hide it and then take a bunch of pills all at once when they feel like they need them. So the only guarantee that my resident is going to get the med is if I stand with them and watch them take it. So we never leave those at the bedside. And if there's a doctor's order to do so, I honestly would probably still stand with them, just because all of those things that we've talked about a few times before. Don't let the container touch any part of a souffle cup. So like the container that the medication is in, like the pill bottle or whatever, or medicine cup or measuring teaspoon. Place the container or bottle cap or lid upside down on a clean surface. We don't want it to touch. We don't want to touch the inside of the cap or the lid. For solids, use the same souffle or medicine cup for all the person's tablets and capsules. If that's approved, that's usually going to be our normal practice there, unless, of course, we're crushing. But if we're giving just, 5 different pills or whatever, we're going to usually put those all in one cup. Use a separate cup for drugs that affect the heart and a separate one for drugs that affect the blood pressure. That would be along the lines of giving the most important drugs first. So if you get to know your residents and you know that, like Lucy, she's, probably going to give you a hard time about her pills, you might be able to get 1 or 2 down. I absolutely would get a separate cup with the most important ones. And then the ones, those are the ones you want to guarantee that you get in. And then, put maybe the rest of them that are not as important in a different cup as your backup. Hopefully we get those in, but that way you can kind of guarantee they're getting the best ones first. Wash the pill crusher after every use. Now that's, you guys are kind of in an easier situation there. At the nursing homes, the hospital even has a big pill crusher. So we have these little pill pouches that we put the pills in to crush them, and that makes it nice because then you don't have to wash the pill crusher in between. All of the medication stays in this pouch that you're going to throw away when you're done. Check with the nurse before you cut a scored tablet. And to cut a scored tablet, there's a list of guidelines there. Now that score in the tablet, again, like we said, does mean that it can be cut in half. So we're okay with that's just kind of an understood. We can cut that one in half if we need to. In the liquid form, we don't dilute or add water or other fluid to a drug unless it's ordered to do so. So if it is like a thicker liquid and the patient, doesn't like the taste or whatever, we're not to, mix that with or dilute it unless it's ordered to do so. Don't mix liquid drugs together. I have seen this before. We give like a Miralax, which is a powder, and we mix it with water so that they can drink it. And then I've seen people like put other liquids in it, kind of just to make a big cocktail instead of giving them multiple cups to drink. And I get that we want to cut back on how much we're like asking them to take at one time, but rather than mixing those, maybe we just need to time them differently. Give cough syrup last if you're giving more than one liquid drug, because cough syrup is given to coat and soothe the throat. So if you're giving continuous medications with water to drink in between and all that, it'll wash that coating off the throat kind of. So give cough syrup last. And if there's extra liquid that you pour into a medicine cup or measuring teaspoon, don't pour it back into the bottle, just dispose of it. Also follow delegation guidelines. Get information from the nurse regarding which meds to give first, if that is something that you need to do with your patient, which need to be crushed or which have capsules that need to be opened. Now remember, again, some capsules are like sustained release or extended release, and we can't open those and pour them into applesauce or whatever. But some capsules we can open them and pour the contents into something easier for them to take. So make sure you're aware of that. How to position the patient when you give them their meds, when and what to report. So all those delegation guidelines come into play as well. Sublingual drugs are given under the tongue, and buccal are given inside the cheek. These are meant to dissolve, so they are not meant to be swallowed. In Arizona, med techs do not give these. Your book has directions for giving each type of medication. These are a fine reference, but remember that we use your black book for state testing, so that's what you need to commit to memory as far as steps go. One more thing that I want to add about oral medications that I probably should have said in the beginning, but here we are at the end of the chapter. Oral medications, I think I've said it before, they're absorbed in the GI system. So they're taken orally, they go, down the GI tract into the stomach, they sit in the stomach, and they get mixed with gastric acids and stuff like that to help them break down. Then they move into the small intestines where they're broken down even further. Some of them are starting to be absorbed at that point. And then they move into the large intestines where we have the most absorption. So just know that that affects the rate of absorption. So if it's in the large intestines, or it takes all the way to the large intestines to fully get absorbed into the bloodstream, the rate at which it starts working is much slower than some sort of injection that goes to the bloodstream faster. So just be aware of that. I think we all kind of have an understanding that if you take a pill, it's probably going to take like a half hour or so to take effect. But different conditions with our different patients or residents is going to affect that rate. Some of the ones are the patients or residents that have like constipation issues and just kind of like slower movement through that GI system might take longer to absorb. And as we talk about the different classifications of meds, we'll learn which ones need to be taken at specific times in relation to other meds and stuff like that. Because if we're giving a med, to slow the GI system, I have to understand that other meds are going to also be slowed as far as absorption goes. So kind of a lot to think about there, and we will talk about it, more and more as we're talking about the different medications specifically. But just an idea again that oral med waits until the intestines to be absorbed into the bloodstream, so they do take longer to take effect. And that's it for chapter 11.